now, without further ado, Dr. Chi and Stephen, thank you so much for joining us, and we can't wait for you to start this program.
Wonderful. Thank you, Kim. It's a pleasure to be doing this webinar series with the World Affairs Council, and we're delighted to have Dr. Chi with us today from Air China. As many of you know, Los Angeles is very dependent on international trade, and our tourism industry is also very much driven by our partnership with Asia Pacific. In 2019, we know that, for example, LAX had over 88 million passengers coming through LAX alone. And of those 88 million passengers, we have seen over 50 million visitors to Los Angeles that contributed to our tourism industry. And they spent over $23.9 billion in just 1 year. And of those visitors are coming to Los Angeles to enjoy the sunshine that's here in Los Angeles, about 7.5 million of them are international travelers, and our largest overseas destination when it comes to travelers coming to Los Angeles is from China. About 1.2 million passengers in 2019 that came from China alone. So this is a huge industry for us, obviously, but also a very important partner for us over the years. And Dr. Chi joins us from Air China, and he's been with Air China since 2004 and has led the efforts on a tremendous growth in terms of the connectivity between China and the United States, especially with Los Angeles. So thank you, Dr. Chi, for joining us today. And without further ado, we're just going to get right into the questions, because I'm sure a lot of our audience members want to ask you some direct questions as well. And as we're seeing this tremendous growth of the last few years, we've seen a disruption in just this year alone. Since the outbreak and the spread of the COVID-19 virus, it's really disrupted air travel for passengers and the airline industry. Dr. Chi, can you please give us a high-level update on international air travel, and specifically the inbound and outbound travel between China and the United States?
Sure, I'll be focused on US-China international travel, which I consider my turf and my neck of the woods. Prior to this outbreak, this crisis, we saw an explosive growth in traffic between the United States and China. Back in 2005, there were about 50-some flights. And before this outbreak, at its peak, there were 402 flights a week. So you can see the explosive growth, and the split between Chinese carriers and US carriers is we Chinese carriers operate 241 flights a week, and then US carriers operate about 161 flights a week. And so that's a very large number of flights. And in terms of traffic, there are about 5 million people going back and forth each year. So that comes down to about 28,000 passengers per day. And now let's take a look at what happened after the outbreak. So now in total, first of all US carriers stopped flying. And then only Chinese carriers are operating. And the total number of flights that we are operating right now is about 12 flights per week versus 402. And then on a per day traffic basis, it's barely 1,000 passengers a day. So you can see the impact.
Yeah. So as we're moving forward, we're also seeing that, especially since March, I think that's when we're kind of calculating the information from just last month. There are only a limited number of airports, I think 10 or 11 airports that were receiving flights directly from China. Can you tell us a bit more about these airports, what's happening there, including LAX, and the importance of those flights now that there's so the limited capacity of connecting us? Knowing that basically this connection directly with China is so important to us. What is happening at the airports on the ground level?
Well, first of all, let me tell you those airports, what those airports are. And the U.S. government, when it imposed travel restrictions on January 31st, 7 airports were named as the airports that were allowed to receive traffic from China. And they were LA, San Fran, JFK, O'Hare, Chicago, Seattle, Atlanta, and Honolulu. And then very quickly, Washington Dulles was added. And then subsequently, Newark, New Jersey was added. And then Dallas, Fort Worth, and finally Detroit. So making a total of 11 airports. So I think the considerations were, number one, these were the airports where typically Chinese traffic go. And then they have the capabilities and they have the know-how to handle Chinese traffic. And then also they have the necessary capabilities for screening, especially CDC screening. So those were the considerations. So if you are a passenger right now arriving at LAX, for example, you're going to go through, the first thing you're going to go through is actually CDC screening. And there are CDC personnel there stationed at the international arrival, and they're going to take everybody's temperature and they're going to collect everybody's information. Then you move on to immigration and finally onto customs. So that's the process.
Got it. With this more intensified, I guess, scrutiny of passengers going back and forth, we're also hearing that besides the United States, some of the airports around the world are also doing some limitations in terms of who can fly and who can fly out. Do you think that there are going to be any major disruptions to, especially for those people who are getting on the flights? Are they going to find themselves in a situation where they're going to land at the airport and realize that they can't actually enter the country and have to be sent back? Have you seen that?
Well, I have not seen that, but I do think theoretically it can happen. Let's say today Stephen is airborne on his way to country X, and mid-air there's an announcement that the border is closed to Americans. I mean, theoretically that can happen, but I think I have a lot of faith in humanity, and I think all the countries around the world have enough wisdom and courage to handle a situation like this. But in reality, I have not seen that happen.
That's good to know. And when it comes to, you're mentioning CDC, the Center for Disease Control, are already doing the screening, and then you go to immigration with the Customs and Border Patrol, and then through Customs and through immigration. So all these different screening process are being implemented in the United States. Can you tell us a bit more about the coordination between Customs and Border Patrol, immigration, and CDC directly with the airlines? Has that been a proactive process? Have they been a good partner to the airlines in terms of coming up with these policies?
Look, I'm a businessman. Normally, I have a lot of complaint about governments. I have a lot of complaint about government agencies and regulators. But in this case, I have nothing but praise for our government on both sides and all the agencies, starting from DOT, FAA, DHS, TSA, CBP. Everybody is number one, very understanding, and number two, very supportive. And so it's been a fairly smooth process, and communication channels are wide open. I get calls from DOT Undersecretary and other senior officials of the U.S. government. So it's actually it actually has been I will say a very, very heartwarming and pleasant experience, given the very, very difficult and challenging and painful situation.
That's good to hear that there's a lot of collaboration happening already. Speaking on the positive side as well, with this challenge, sometimes we see innovation that's happening. We're seeing new things that can happen. Are you seeing any new business or trade patterns that are emerging as a result of what's happening right now with COVID-19?
Well, I would say in the in the short term, I don't think it's going to happen. I mean, in terms of aviation, my sense is this is going to come to pass and will rebound. Longer term, there are the longer term issues. I guess we're not even in a position to think about it right now because we're in such a survival mode. But in terms of what's been going back and forth, it's very, very different from what it was before. So, for example, when it comes to cargo, in the beginning, when the situation was bad in China, everything that was going, there was nothing coming out of China. Everything was going to China, and everything was actually PPE or other medical supplies. And then the situation changed when China calmed down a little bit, and and the U.S. kind of blew up a little bit. Then it's the opposite, and everything coming out of China now is medical supplies coming to the United States, and in fact we're playing a big part in that. We converted some of our passenger airplanes to cargo airplanes on an interim basis, and then we move a lot of medical supplies to the United States, and over time things are gradually opening up in China, so businesses and factories are going back to work. So we're seeing some cargo now coming from the United States to China, like car parts and even the good news, very encouraging, even lobsters are now resuming going back to China because certain restaurants have now opened and they're doing business. And unlike I was on my way here when I heard on the radio the struggle of our restaurants here, especially mom and pop restaurants. It's heartbreaking.
It is, and as I was mentioning before, Los Angeles is so dependent on our tourist industry, and to see that with the decrease in the number of passengers are coming to visit Los Angeles because of our stay-at-home order is really having a direct impact on a lot of these restaurants, shops, and our theme parks. So this is having a devastating effect. But to hear that there's some positives that are coming out of this is great, especially now that there's maybe some hints of increased trade happening again. And LAX last year, there are over $100 billion worth of cargo that goes in and out of LAX every single year. So obviously this has had a severe impact on our cargo trade as well. And to hear that lobsters and also car parts are going back and forth, this is a glimmer of hope for us as we're looking in the future. Speaking of hope, we're also seeing that this really tough global crisis around the world as we're looking at the suffering and the pain, but we're also seeing a lot of partnerships, relationships that have been built, that were built before, and now is coming to fruition in terms of international partners supporting each other. This international cooperation is going to be key for the recovery and for us to be able to survive this as a global economy and as people. Dr. Chi, can you talk a little bit about what you've seen when it comes to international cooperation and things that have been happening from your perspective that demonstrates this cooperation that's helping us get through the period?
Sure. This is a very heartwarming, I call it a human and humanitarian story. And I remember distinctly on January 31st when the U.S. lowered the boom, so to speak, on travel restrictions, and obviously I was shocked and I was blown away and didn't know what to do. But then the first phone call I got was from an old friend, and he sits on President Trump's coronavirus task force, and he said, "I just want to give you a call and see how you're doing, what we can do to support you." And that was very, very encouraging. By the way, he's a local Los Angelino, and Angelino, by the way. So then the second call I got, it was from this undersecretary of DOT saying, "Hey, what can we do to help you keep flying? We don't want nobody wants the air links between the two countries to break down." And so there's a lot of back and forth, a lot of discussion, sleepless nights, and figuring out what to do. For example, the very first question I had for them was, you want us to fly? I mean, we'd be happy to. And by the way, Air China has, as a company, we have certain responsibility other countries don't have. For those who don't know the term flag carrier, we're the only flag carrier of China, meaning we are the only airline in China who is authorized and privileged to have the Chinese flag painted on our fuselage. So we represent China. So in these very hard times, flying is actually pretty much a suicide, because every flight we operate, we incur a loss. But we're going to have to do it because, well, somebody has to do it, and if somebody has to do it, it's us. And with the U.S. carriers gone, and only Chinese carriers will fly, and we are the designated one. I mean, self-designated one. And when you think about it, I mean, there are going to be medical supplies flying back and forth. There are going to be first responders going back and forth. And then there are going to be medical personnel, professionals going back and forth, and then some emergency government consultations, and also some emergency travel. For example, the other day we just handled a patient who badly needed a marrow transplant back in China. Imagine if our flights are not operating, what could possibly happen and to him. And then also all the kids who are going to school here. There are probably 200,000 kids going to school here. I mean, Chinese kids going to school here in the United States. And so many of these schools are either closed or they turn to online courses. And then the kids are panicking, their parents are panicking. How do we move them back? And if we don't have the flights, and they'll be stuck here. And I get phone calls from parents in China, help us, help us, help us. And so, and in this case, I think it's a very heartwarming story, because the first thing I wanted to resolve was, if the travel ban applies to our crews, we couldn't possibly fly our airplanes. Pardon me. And very, very quickly, the federal government responded and say, those restrictions are gone. Your crews are free to come in. And then we also needed to change our routing a little bit, which are not even permitted under the current air services agreement between the US and China. They bend the rules and they say, do that. So I will say, in this day and age, this is a shining example of the cooperation between these two great nations.
Well, I'm hoping to see this continue. I think sometimes when it comes to a crisis situation, we see the best of humanity in terms of what we can do together to resolve this global crisis that we're facing again together. We're also seeing, you mentioned a couple key factors that are with these emergency responses. We're seeing that there's been an increased number of different folks reaching out to the World Trade Center here in Los Angeles. Our partners over in China and from all over Asia are saying now they have excess capacity. You mentioned this a little bit in terms of medical supplies, personal protective equipment, PPEs, masks, ventilators, and such. So a lot of them are reaching out to us to distribute goods into through Los Angeles, because California, as you know, will probably have an increased demand for supplies in the upcoming weeks and months. What is the best way you think are people getting the products through? Is it by air or by sea? Do you know from just basically anecdotally how are they basically getting this equipment in? Are they contacting Air China directly to move these cargoes into the region?
Let me first of all tell you the action that the communities here took when the outbreak first started in China, especially ethnic Chinese communities. Now, this is a number published by Chinese Customs, so it's not even my numbers. So ethnic Chinese folks from around the world purchased and shipped 2.2 billion masks to China. And actually, we played a part in it in terms of shipping them back to China in those dire days. Now things are getting worse in this country, and the ethnic Chinese community, again, especially those who are associated with the U.S. in certain ways, for example, the kids go to school here or they have relatives here, they go to action again, in China in this case. And they say, hey, what can we do to source those supplies that you cannot find in the U.S. and find a way to ship them here? And I get calls from them and say, hey, how do you guys can help? Now, we would be very happy to help, but typically the way it goes is freight carriers like us, we are responsible from airport to the airport. And so, but then you can call us and we can tell you who you can work with as what we call a freight forwarder, who can set everything up for you, like how to clear customs, what to do to package the goods. So yeah, feel free to call us and reach out to us, and then we'll direct you to the right people and get it done.
That's really good advice, Dr. Chi. And I know that there are a lot of the audience members who are looking to ask questions. So I'm going to turn this now over to Jessica Gansik from World Affairs Council to bring some of those questions that have been coming in via the chat and the question option people have been typing. Jessica, can I pass it back to you, please?
Great, yes, thank you. Dr. Chi, do you expect new health regulations on international routes post-COVID-19?
Can you repeat your question?
Sure. Do you expect new health regulations on international routes post-COVID-19?
I think there's already a tremendous amount of help afforded by the federal government to the U.S. carriers, and obviously we don't get that because we're not a U.S.-based carrier. As you probably know, $58 billion is going to be provided for the U.S. airline companies, and $29 billion towards the payroll. So then the airline companies are not allowed to lay off their employees, and then 29 billion in the form of loans or loan guarantees. So there's already a lot of action taken on the U.S. side. But when I think when this is over, tourism does need to rebound. And by the way, I have no doubt tourism will rebound, because I don't think you can suppress human desire to travel, to see the world, to visit their friends and family. I'm a little bit worried about the business side though, but I'm sure that Stephen is probably more concerned about the tourism side. So that side, I think it's gonna come right back. I mean, not overnight, but gradually it's going to rebound to its previous level, maybe even higher. And I suppose tourism authorities around the world are going to put in some dollar and or effort to promote travel, to induce travel.
Thank you. Going forward, what lessons have been learned about gaps in the global pandemic warning system?
Oh boy, that's a hard one. You know, you call me doctor, but I'm not a medical doctor. So I have a PhD in a very technical field. I don't really have a clear answer, but I do think there needs to be a lot more coordination between countries. I think there have been a lot of surprises. If you hear Dr. Burke say yesterday that well, you know, we wish we had known a little more about this virus, so that tells us that probably there needs to be closer and more frequent collaboration and coordination between health service authorities around the world.
I can jump in here as well, I think that we've seen in the past, especially after the SARS epidemic in 2002, 2003 in Hong Kong, the Ebola and also Zika virus outbreak, whenever you have these threats, you see more coordination. I think this is the first time we've seen anything like this when it comes to a global threat affecting every country around the world. So I do think that the health officials through WHO and other organizations are going to be a lot more closely tied in together. I think this is really a wake-up call for all of us to realize how connected we are. I think we know that already, but I think this pandemic is really challenging our existing understanding of what the connectivity is really like. So moving forward, I do believe that WHO will have a more significant role working with the various municipalities as well as countries around the world to set up these notification and communication strategies.
So if I may, I want to throw in something else, what Bill Gates said. So Bill Gates said, the one thing that keeps me awake at night is not nuclear warfare again. It's actually the pandemic, and the world is not prepared for it. And in an ironic way, we played a role which is probably not very positive. I mean, we promote travel, and so the world is really connected now. And airlines played a very positive role on that. But then, on the other hand, I think health officials and whatnot, they need to be prepared how to handle the situation given this super connected world right now.
Thank you. Is it true that there is only one passenger flight per week now? How about cargo flights?
It is true that there's only one passenger flight. It is actually 11111. Let me tell you what that means. Per CAAC mandate, between any country. So for one country, there's going to be only one carrier operating on one route, operating one time a week. So in this case, there are perhaps three routes. In this case, us, China Eastern and China Southern, perhaps Xiamen Airlines. So each carrier gets to operate one time a week from on one city pair. And then cargo flights, no. Cargo flights, there are no restrictions. And as I was mentioning earlier, now all the medical supplies are pouring in from China, and especially to New York. And so we don't have enough freighters to do that. What we did was, again, this is suicide commercially. We took our passenger airplanes and then stuffed the belly with cargo. And those are nothing but PPEs and nothing but medical supplies, and then fly them to the United States.
Thank you so much. What measures and strategies are being put in place now to set you up for success as soon as this is over?
Wow, this is a great question. Long-term, very long-term question. Now we're obviously in a crisis mode, but we're also thinking. And what's going to be the long-term impact of this virus outbreak? First of all, obviously we need to survive. So we're in a survival mode, and we very quickly reduce our scale, except those we deem absolutely necessary for human and humanitarian reasons. And then we're trying to gain efficiency, trying to reduce our costs, and also we are going to probably seek assistance from governments and the authorities and whatnot. And longer term, we're really reading how this will impact us in terms of traffic pattern. For example, I think we're going to see probably a permanent reduction in business travel. And we're now so comfortable with, well, not so comfortable, but we're getting more and more comfortable working from home. And I'm predicting probably a significant amount of business travel is going to be gone. And that's going to hurt us big time because, business travel is bread and butter for airlines, and that's our high yield component. And we live or die on business travel. So then what's going to happen? And we don't know yet. And so at this point, it's my honest answer is we have more questions than answers.
Thank you. Do you think we're going to see cancellations on the development or building of new aircraft?
No, I don't think so. But I do think I do think the fleet mix, aircraft mix, will change. So, for example, those super jumbos are going to be gone, and the A380 probably will no longer be sustainable. And but newer airplanes, more efficient airplanes, will continue to be developed. And if you look at the 787 and the A350, those are two very successful airplanes. And then also you're going to see the A321 long range, and that's a narrow body airplane, but they can easily fly across the North Atlantic. And you'll probably see Boeing come out with a competitive response to the Airbus A321 LR as well. Yes, Boeing is going through a very, very hard time, but again, I think they will be able to handle it, and this will be behind them. And no, aircraft development will be back on track.
Thank you. Do you expect Air China to immediately resume all of its US routes once the pandemic is over, or will it be a slower ramp up, or will some routes remain suspended permanently?
I don't think anything will be suspended permanently, so let me get that out of the way. And as I said, I'm very proud of what we have achieved here in the US, especially in LA. When I first joined Air China in end of 2004, we were operating 3 flights. Now that's 3 flights a week between LA and Beijing. And before the outbreak, we were operating 3 flights a day, 7 times of what we did before. Now between North America, now I'm lumping in Canada, we were operating 16 flights a week. 16 flights a week when I first joined, and now we operate north of 90 flights a week. So no, we're not going to cut any destinations in the United States, and but we're going to follow the market, and we know it's gonna take take a while for the market to come back, but at the same time we will be proactive. We will be work with tourism authorities, and we will do some heavy promotions to induce travel, to bring travel back.
Thank you. What are the triggers that will start to move the airlines back to normal?
Well, the first thing that needs to happen is the lifting of travel bans. Now there's the U.S. imposed a travel ban on Chinese travelers. So that's more than 50%. That's probably even 70% of our business. That's gone immediately. And now China imposed a travel ban on U.S. So those need to be those need to go for in the first place for us to be able to operate under any normalcy. So, and then obviously the economic impact, how fast the economies can come back, businesses can come back. So there are a number of factors.
All right, I like this question. Airplane manufacturers are designing planes with much higher density in coach, such as the bicycle seat with a back seat design. Will the pandemic alter passenger seat design, especially in coach?
I think that's a hot button issue that's being debated amongst the aviation community. There has been a lot of discussion before about jamming more seats on an airplane, And personally, I don't like that, and I think it's the wrong approach. And those who do it, their argument is, well, look at American Airlines, look at United Airlines. American Airlines did something called more legroom, and they actually took seats out, increased legroom, but they found out economically it didn't work out because passengers were not willing to pay for it. So there are opposing arguments going back and forth, but I think in the end, maybe the dynamics will change because of this outbreak, and perhaps health and personal hygiene becomes more important, and passengers are probably will clamor for more space, and airlines and airframers will react and respond accordingly.
Thank you. Can you share what you've seen from people in China starting to look into future travel? When do you think they will start traveling internationally again?
Well, I think if as soon as they feel safe, they will want to start to travel. If we look back on SARS, we saw an explosive growth. We couldn't handle the traffic. My sense is this probably will be a little slower, because I think the scale of this outbreak, this crisis, was bigger, probably much bigger than SARS. So it will take a little longer. And the economy is hit pretty badly in China as well, and the businesses are still not coming to work fully, and so people's income and people's wallet got hit pretty hard. So for tourist traffic, for leisure traffic, there's a direct link between income and wealth and travel. So it probably will take a little bit, but eventually, I have no doubt it's going to come back, especially the U.S. I think I'm a little biased because I live here and I'm a naturalized U.S. citizen. I strongly believe that U.S. is the #1 destination, desired destination for Chinese tourists, and LA is again right on top.
Thank you. Post 9/11, there were consolidations and mergers among U.S. airlines, with flagship carriers like Pan Am and others like TWA disappearing. Any predictions on the global airline profile post-pandemic, and do you predict a big reduction in international flights?
I don't think there's going to be a big reduction in international flights, but I do think there's going to be some consolidation, and it has to happen. And there's not an iota of doubt in my mind. How is it going to pan out? I don't know. Whether it's going to be a purely commercial and private sector operation, or is it going to be government induced? I don't know, but both can happen. But I do believe that consolidation is inevitable.
Thank you. How will the postponement of the Olympic Games affect travel patterns and revenue for Air China?
Well, the Olympics are not going to be held in China, so I don't know how big an impact it's going to have on us. Although Japan is a close neighbor of China, and we do run many flights to Japan from multiple cities in China. So I go. In fact, the postponement is a good thing, because that will probably help us, because if the Olympics are held on time or in time, then as scheduled, then there will be probably less traffic, a bigger impact on us. And while it is bad, let it be bad for now, and let it be really bad. And then later on, when it recovers, we still have an opportunity to capture that traffic, capture that Olympic traffic.
Thank you. When travel reboots, will airplane air filtration systems be adjusted and appropriate quality masks and gloves be made available to ease passenger transitional discomfort?
Well, for now, we struggle to supply our crews with masks. In terms of air filter, the modern day airplanes are actually very good at that. The what we call high efficiency particulate air filter (HEPA), those filters can filter about 99.97% of the bad stuff, and not only that, the air circulation is very, very localized. So you take a section cut of the airplane, the air basically in that little section just circulates amongst itself. It doesn't go back and forth. So if there's a person who is not well in front, his or her air will not get to the back. And not only that, the air circulation is very fast. Every 2 or 3 minutes or 3 or 4 minutes, the cabin air is completely replaced with fresh air from the outside.
Thank you. And this will be our final question. She said they loved the lobster story. What other examples do you have relative to things getting back to normal?
Not at this moment, but lobster is a luxury product. If you think about it, when folks start thinking about lobster, they are beginning to want some joie de vivre, and they want to live a life. They want to enjoy it. They want to have a great time. So that's actually very, very positive. And I think sooner or later we're going to see flowers beginning to travel on our freight airplanes. But they typically come from South America, and they'll come to LA or New York and whatnot, and then go back to China. So those are going to happen. You cannot suppress people's desire to live a good life. You just cannot.
Great. Well, thank you, Dr. Chi, for your insights and for answering all those questions. I think it's given us a glimmer of hope in terms of what can happen in the future, especially your comments about Los Angeles being really the primary location for Chinese destinations, tourist destinations in the future as well. We're looking forward to that. So we're looking forward to seeing a lot more of this, the lobster stories to start coming in. We definitely are eager to have us get back to normal business. So thank you again, Dr. Chi. Thank you, Kim, for your great partnership and support for putting this webinar together.